or on YouTube as well. I am wearing my new Barton hoodie today. Actually, this is my husband's. It was a little short on him, so I inherited it. But I think I have a blue one coming, maybe. On YouTube as there we go. YouTube is live. There we go. Okay, hello everyone. Welcome. We're live here on YouTube. I just want to remind you that all of our webinars are recorded. In fact, they're live right now on YouTube. So you can go back at any time. I get several emails and messages each week just about that. People wondering if, or they hop on late and they miss part of it, or they want to watch the replay because Dr. Saunders just drops knowledge like he always does, and people want to hear it again. So you can go to our YouTube channel. If you ever are like, how do I find that again? This is what I recommend. Go to bartonwebinar.com, click on the YouTube link, and subscribe. So that way you'll always be notified whenever we upload a new webinar, okay? So hello and welcome. Today we have a fun topic. I'm gonna switch my view there. Now you guys can see everybody probably. We're going to talk about the dangers of visceral fat. So I want to quick remind you that Dr. Saunders, while he is an excellent doctor, he is not your doctor. So we just ask that you discuss these things with your healthcare provider before you implement any of the things that we talked about today. First of all, Dr. Saunders, what is visceral fat?
Well, this is very interesting. So if you take your belly and you pinch the skin, and you could get a certain amount of fat, right? And they used to say, well, if you could pinch an inch, then that's too much fat, and you need to lose some weight, right? Well, that is subcutaneous fat. That's not the visceral fat, and that's not really important. The subcutaneous fat is actually not really important as far as health goes. It's not important in diabetes. It doesn't have any issues associated with it. The amount that you can pinch on your skin is really less important. It's what's on the inside. And so visceral refers to your organs, all your organ systems. So it's the viscera, which is your liver, your kidneys, your spleen, your stomach, your pancreas, your intestines, and all of that has fat around it. If you've ever, um, if you've ever cleaned out you'd have to kind of start from scratch. I was going to say a turkey or a chicken or something like that, or any kind of animal, even fish. If you've gutted a fish, then you get this fat that's around the organs, that's not in the skin. And what is that fat? That's visceral fat, and it's really a special kind of fat. And it causes, when you have a lot of it, it causes your belly to push out. And so people who have like a big belly and it's pushing out, it's not from the skin, it's from the inside. It's this fat that's on the inside. Why is it so important? Well, it's related to diabetes most directly, because it's related to your metabolism. So when your insulin goes up because of insulin resistance, you put on more visceral fat. People who have a lot of stress put on more visceral fat. And so the fat around their organs gets thicker and heavier and more, and it's pushing everything out, and it's taking up the space in your intestines, or where your intestines will normally go. And so all of that would be like filled with fat around it. Okay, that fat has certain qualities, one of which is to decrease your metabolism. And it allows you to be more, I guess, efficient, sort of. You use less energy. And it also has something in it called cyclooxygenase, which is an enzyme that converts your testosterone into estrogen. Now, for women, that could be a problem, because if they make extra estrogen in their visceral fat, it will affect how their ovaries function. and they can get irregular menstrual cycles, and they can get they could have infertility problems and excess bleeding, and they could have estrogen dominance, which can cause ovarian cysts and uh, uterine cysts and uterine fibroids and breast cysts and fibrocystic breasts. So these things that are estrogen dominant could be affected by having this excess visceral fat. In men, it increases the prostate. Your prostate can grow more. Estrogen does that, and so enlargement of the prostate, and then also prostate cancer is more likely. And it also causes men to get man boobs because you're actually making women hormones out of your man hormones. And so it's not so much the amount, but the balance. So you have these men who are high estrogen, low testosterone, and they go, oh my gosh, my testosterone's low. And they go to a doctor, and the doctor says, you need testosterone, and gives them testosterone, pellets or injections or cream or whatever. And so what happens is you have the high estrogen and high or low testosterone. And so it brings up your testosterone and brings up your estrogen with it. So now you have normal testosterone and higher estrogen. And so that causes more problems. So it doesn't actually resolve the issue to do that. This visceral fat is not benign. It's really important. And you tend to put on more fat as you gain more of this visceral fat too. So it's related to diabetes because insulin tells you to put on more visceral fat. And when you shut off the insulin, you start using up the visceral fat. So if you've ever seen, there's been several movies about fasting. One of them was from Australia, and I don't recall the name of it. And it was these two brothers that fasted for 20 days. And they were not fat to begin with. And they didn't have like big obese stomachs, or they didn't have a lot of subcutaneous fat. But what happened is over time, they showed what happened over time, a daily change in how they looked. And their bellies went from just a little poochy down to their bellies curved in. They had lost all their visceral fat. That's the one right there, the healer within, fasting, the healer within. Yeah. And it's amazing what fasting can do. So that tells you something about the visceral fat, that it's made by insulin. So when you have insulin resistance, you make more visceral fat. When you make more visceral fat, you change your hormones, your estrogen, testosterone balance. You also change your cortisol, and it affects your whole body. It's not just one thing. Your organs have all this fat around them, and it's affecting back pain and how your intestines function, and the function of your organs. So getting rid of visceral fat is very important. If you have a big belly, then you want to get rid of it. So the first thing you want to know is, how does it happen? How do you get visceral fat in the first place? Well, think of it this way. When I was in Venezuela, I used to live in Venezuela, and then we had, I noticed people there, and it's really easy to see because they drink a lot of beer. I think per capita, they drink more beer there than anywhere else. And so what happened is, by the time a man was 30 years of age, his belly was so big that they couldn't button their buttons on their shirts. So their belly would stick out of their shirt because they couldn't button it because the belly was so big. But at the same time, their arms and legs were skinny. They had skinny arms and skinny, these stick legs, stick arms, and this big old huge belly. Why is that? How does that happen? They didn't get any subcutaneous fat, and they didn't have any muscle, but they had this very large belly. Well, think of beer. What beer is? It's a pure carbohydrate. Not just the alcohol, but all the carbs in beer, because it's made out of, hops and barley. And so you have this very high carbohydrate drink that they're drinking all the time, every day, all day long, sipping on this. Every time you sip on something and it has carbs in it, then you're releasing insulin. And then you take another sip, you release more insulin. Take another sip, release more insulin, more insulin, more insulin, more insulin. This constant level of insulin is causing this belly fat, this visceral fat to build up larger and larger, but no subcutaneous fat. You're not getting it on the arms and legs. You're only getting it in the belly because it's just pure carbohydrate. You're not eating any fat. You're just eating carbs. So that tells you something about what to do for this. And what to do for it is not to go on a diet. Fasting is great because fasting gets the insulin level down and allows you to start using that fat for energy. And if you even chew gum that is artificially sweetened, 0 calories, it's going to cause the release of insulin and you're going to put on more belly fat. So you don't want sugar-free gum. You don't want sugar-free drinks. You don't want things sweetened with stevia or monk fruit or anything else. You don't want anything that tastes sweet or anything that has carbs in it, because that's going to cause you to put more insulin in, cause you to put more belly fat on. So the way to get off that is to get off everything that tastes sweet, and actually a good way is fasting. But if you just get off everything that tastes sweet, then your insulin level will tend to go down. And then you'll be able to start using this fat for energy. And then when you exercise, you'll start using the fat for energy. And it works all the way around. The key is to get the insulin level down.
Okay, so KJ says, so I guess an occasional low carb beer is a no-go.
No go. No, you know what? That's the thing about, is it occasionally okay to do something that's bad for you? I don't know. We had this discussion last week, right? Remember when I told you guys last week that would you ever eat ice cream under these conditions? Remember, you have a limbic system and a frontal lobe. Will your frontal lobe ever say, yeah, it's okay to eat ice cream? Yeah. Or are you ever going to have Lucky Charms? Your frontal lobe would never allow that. And so the answer would be no, never. You just, I remember I had a Pop-Tart toaster pastry. Now, when I was a kid, like Pop-Tart toaster pastries was, my mom would never allow us to have that. And so when we went camping, we got Pop-Tarts. And that was like, oh boy, I want to go camping so I can have that. And then one day, much later, when I was a scoutmaster, I had one and I was like, oh my gosh, this tastes like a bunch of chemicals. That was the last one I had. And I realized, you know what? You never need those things. There's never a reason to eat a Pop-Tart toaster pastry. There's never a reason to eat ice cream. There is never a reason to drink even your low carb beer. It's just like, you don't need that.
Right. Okay, so KJ also said, two questions. I just started a 72-hour fast. Should I continue to take the supplements? Most of them have instructions to take with food. And there's another question, but I'll let you answer
Okay.
that one.
So while you're fasting, don't take any supplements. Remember, supplements are food. So just don't take them at all.
Okay, this might be a question for Joe too, but also, what is the effect of the rum-soaked peanuts before every meal? I haven't heard about rum-soaked peanuts in a while.
Don't do rum.
Yeah, I don't think we've talked about that in a long time, but yeah.
Used to have a marketing piece that talked about it. There are studies that show rum or alcohol does lower blood sugar, but there's just too many other reasons not to consume alcohol. So the point of our marketing got misunderstood, and then people started, yeah. So the better alternative is well, fasting.
All right. Okay. Let's see. We have some more questions I think that have come in. You know what? Dr. Saunders addressed this maybe a couple of weeks ago, but we have some people that are curious about what that is on your face, Dr. Saunders.
Oh, yeah. Okay. So I have a basal cell carcinoma. There's three different ways to handle squamous cell carcinoma and basal cell carcinoma. And one of them is to do surgery and Mohs microsurgery. It works pretty well. I've had a few people that have had recurrences after Mohs surgery, and then they have to have another surgery. But it mostly is really good. Then there's the other one, 5-fluorouracil, which is a chemotherapy agent. It's pretty caustic. It kills all of the growing cells, so it makes your face turn all red and everything. And I kind of wanted to avoid that. And then there's what I'm doing. It's called BEC5, Curaderm. Yeah, it's an eggplant cream that does not kill normal cells. It only kills cancer cells. so if you just keep putting it on there, and it will gradually kill all the cancer cells, and it'll make an ulcer because all the cancer cells will die, and then all the normal cells will fill in and gradually fill it in while you're still putting the cream on. So it takes let's see, I'm in my third week, and it usually takes like 6 weeks or 7 or 8 weeks. This the Yeah, anyway, it's getting better.
All right. David said I had itching all over my body, and the dermatologist told me it was an allergic reaction to metformin. Is that possible? He gave me a cortisone shot, and the itching went away, but the blood sugar went up.
Yeah, the blood sugar is going to go up because of cortisone. Remember, that's the morning effect, the dawn effect. When your cortisol goes up, then your blood sugar goes up too. But it did make the itching go away. That's good. And yes, you can have a reaction to anything. There is nothing that you can't react to.
I know it's interesting too. I'm just going to say this, but I have had experience with that where I've had some intense itching and I've gone in and no one asked me what I ate. They're only asking about medications, which I think is really interesting because food can do that as well.
Yeah.
So something to consider. Just like I know somebody who is not celiac, but when they eat gluten, they get rashes all over their body.
Mm.
And the body really does respond to things in very interesting ways. If we pay attention, we can figure it out.
Non-celiac gluten sensitivity. A
Mhm.
lot of people have that. It's not that uncommon.
Yeah. I have another friend who is not celiac, but they get anxiety when they consume gluten really, really badly.
Oh, interesting.
Yeah. Okay. All right. Let's see another question. After doing a stress test, the cardiac doctor wants me to take rosuvastatin, calcium 5 milligrams every other day, also metoprolol, succinate, 25 milligrams every day. They said I needed these because I had 6 irregular heartbeat when I was under extreme stress. I'm 77, male, and did 10 minutes on the treadmill doing the FAA treadmill protocol.
Oh, okay. So if you were able to do the treadmill protocol and had no issues, the arrhythmias under stress might happen, but there isn't anything that rosuvastatin is going to do for that. Metoprolol actually does slow down your heart. The problem with slowing down your heart is it also weakens your heart over time. So it's not a good long-term solution, and neither of those are long-term solutions for this. What would you do instead? Would be my way of looking at it. If you had you're 77 years old, let's say, just speaking in general, right? And you had a few arrhythmias when you stress your heart out. What that tells us is that there's an energy production problem in the heart, that there's not enough mitochondria. So what you would do is exercise to build mitochondria, and then you would add some of those things that help you to build mitochondria, taking extra coenzyme Q10 and L-carnitine and magnesium and D-ribose. And so if you take these 4 supplements, then you will increase the number of mitochondria, which will increase the energy production of your heart, which will prevent you from getting arrhythmias in the future.
Let's see. Jan says, I'm scheduled for hip replacement finally, and my BMI is 44. Do I need to go back on my diabetes reversal, or do you have suggestions? It is scheduled in 34 days. I'm hearing fasting, but how much?
Okay. Okay. There is like nothing better that you can do than fasting. Really, there really is nothing better for your health. What it does is it puts you in repair mode. So you start repairing. It's the anabolic metabolism. And if you're not fasting, you don't get the anabolic metabolism. So that's what you want to do, is repair. It reverses the diabetes very quickly. And so the question of how much is really more of how much do you tolerate? You start out with a little bit. Some people start out with just 12 hours, and then they go to 16 hours, and then they go to 24 hours, and then in a week they'll do like maybe 24 hours once a week for a little while, and when they get really used to that, they'll go for 2 days once a week. I think the optimum is about 3 days of dry fasting once a month. And what that does is allows you to be in autophagy, because it takes about 2 days to get into autophagy. And then you allow another day of cleaning out. And that's what that 3rd day is for. See, I've worked into it over a long period of time. And so for now, it doesn't affect me at all. I don't get hypoglycemic anymore. I used to, and I used to pass out. I've passed out before when I'm working up to this. So, it's not like you automatically, oh, I'm just going to quit eating and then I'll be fine. You have to work into it. You have to make it, make it your own. Like, take time to fast for a little bit longer, a little bit longer, a little bit longer, until you get really good at it. Just like anything, if you practice, you'll get good at it. Looks like Leslie disappeared. And the other part about what to do, you don't want high blood sugar when you're having surgery or any kind of procedures or anything. You want to have normal blood glucose, and you don't want insulin. Insulin is a hormone that you want to avoid while you're trying to repair your body. So that's why fasting is really good during the repair process. And if you've ever heard of the 6-10 reset, we often talk about not eating after 6 o'clock in the evening and then going to sleep by 10 o'clock. So the idea is to have an empty stomach when you go to bed, because that puts you in anabolic mode, and that's repair mode. So you repair while your body is fasting and sleeping. And there's 2 things that we miss in our modern society: fasting and sleeping. Why? Well, because we have food available 24/7. Man, I am just amazed at how many people use Uber Eats and all these delivery things. And they don't have to go out. They don't have to stay in and make food. They can stay in and order food out, and it comes to them. And gosh, it's really expensive. I can't afford it. I don't know how they do it. And so, but you have all of this food available 24 hours a day. And it's really not good for you to be eating that often. It's not good for the body at all, especially at night. So some people think they'll do intermittent fasting by skipping breakfast in the morning, and then they eat late into the night. They'll even skip breakfast and lunch, and they won't eat till 6 o'clock in the evening, but then they'll eat late into the night. Do you know what? That's not helpful. So there have been all these studies done, and you've probably even seen some of the research that shows intermittent fasting does not work. People didn't lose weight. Their diabetes didn't get better. Their metabolism didn't get better because they were eating at night instead of in the morning. So when you're doing intermittent fasting, it's important to eat breakfast in the morning and skip dinner. That's the way to do it. And if you eat one meal a day, make sure it's your morning meal. That's the one you eat, and then you don't have to eat for the rest of the time after that. That really helps the body to function better, because when you go to bed with an empty stomach, then you're able to make a human growth hormone. So most people don't know this. When I was in medical school, we were told that human growth hormone was just for little kids. Yeah, little kids, they grow up, and once they reach full height, then they don't need human growth hormone anymore. Nobody needs it. Adults don't need it. A little while after that, they found out that human growth hormone was not only good for the body, that it was essential for repairing and improving the function of the body. They found that people had less diabetes if they had human growth hormone. Their muscle mass was better. That this human growth hormone was really important. So people started getting injections. If you remember in the 1990s, there were a lot of people who were starting to get injections of human growth hormone. Well, the problem with that is when you mix the human growth hormone with the catabolic hormones like cortisol, then you end up getting cancer. So you don't want those mixed together. So the way the system is set up is just perfect. There is no better way it could be set up. In the morning, you release cortisol, like a lot, like it goes up, your numbers will go up between 10 and 20. And then as the day goes on, your cortisol drops down. And by the 10 o'clock in the evening, your cortisol level is going to be like 0.05. It's like it's a hundredth or less of what it is in the morning when it's released. And then at that point, you can release human growth hormone and initiate the repair process. So when you look at the circadian rhythm, it's a beautiful system that just flows really nicely. Cortisol goes up, drops down low. When the cortisol drops down low, the human growth hormone comes on, and you get a huge spike, just like with the cortisol in the morning, you get a huge spike. In the evening, you get a huge spike of human growth hormone if you don't have cortisol, if your stomach is empty, and if you're asleep. So that's why it's so important to be asleep with an empty stomach at 10 o'clock at night.
Okay, I don't know if I had to step away for a second, but I don't know if you addressed any of this, but there's a couple questions about eating sweet fruits and like stevia leaf sweeteners. We better dig into that a little bit.
Okay, the taste of sweet. So we're talking to people who have insulin resistance, right? So I'm assuming a lot of insulin resistance. So I'm talking to you specifically, and what stevia and artificial sweeteners, sweet fruits, all of that, what they do is cause the release of insulin, and so that's a problem for people who are insulin resistant already, because then you make more insulin and you become more insulin resistant. So then you would not have sweet fruit. So for example, yesterday I talked to somebody and I said, okay, I want to give you options. I want you to look at this. So you have insulin resistance. And so there's two ways to handle this. One is if you take out the carbohydrates, so you don't have any breads or cereals or rice or corn or beans or fruit or anything that tastes sweet. So you would completely avoid anything that tastes sweet. That would be one way of doing it. The other way of doing it would be to completely take out the fat. Because if you remove the fat, then you could have watermelon and and pineapple and mango and apples and oranges and um, beans and rice and all that stuff. So why is that? Well, if you don't eat fat, then you don't get insulin resistant. And if you don't eat sugar, then you don't make excess insulin. See what I mean? You can do either way and it's going to work. So, but you have to choose one or the other. You can't say, well, excuse me, I'm sorry. You can't say, well, I'm going to eat this high fat meal, and then afterward I'll have some pineapple. No, that wouldn't work, or stevia or something like that, because that's going to cause you to make insulin, and you're already going to be insulin resistant because you had a high fat meal. So he looked at me and he said, you know what? There's no way that I'm going to go without meat and avocados. So I'm going to choose not to eat any carbs. So I'm going to go on the low carb. Well, in the diabetes solution kit, that's exactly what our solution is to cut out the carbs, 20 grams of carbohydrates a day maximum. and you could even have less than that. And it works. It's a great way of decreasing that. So don't eat sweets of any kind on this diet. You're muted. You're still muted.
You can find this at bartonwebinar.com. There you go. I just took the blur off my camera, but it's not blurring, or it's still blurring. So I don't know what's happening. Okay. I'm getting a lot of really good questions, which is wonderful. If you can post those in the Q&A, that would be even better. Those of you that are posting in the chat, it's just a little bit easier for us to organize those. All right, so I'm going to go to the next question here. Now, Monty says, I've adopted an OMAD way of life for the 1 meal a day way of life for the last few months. So only take supplements at that meal?
Yes.
Okay.
Yes, absolutely. Some supplements you can take on an empty stomach, but a lot of supplements, especially minerals, you may find cause irritation of the stomach if you don't take it with food. And fat-soluble vitamins are absorbed better with food. So as a rule, yes, take them with food.
Okay. Gerald says, I'm not on any prescribed diabetic drugs, but I need to get my A1C down, and I'm looking for natural ways to get it down quickly beyond fasting alone because I still work.
Okay, there you go. The Diabetes Solution Kit is the answer to your problem, because the medications are not going to be useful. They're not long-term, they're not helpful, and they're not a long-term solution. Whereas the Diabetes Solution Kit is a long-term solution. And it'll get it fast. We've had people who've told us that, in a matter of a couple of weeks, their hemoglobin A1C came down significantly.
And if you're someone who is like, wow, it's January and I'm looking for some weight loss, that's another option too. That actually does help with that as well. So consider that. Okay. Let's see. Melinda says, what can I do for severe fluid retention? Probably due to low kidney function. GFR is 9. I'm on furosemide, 120 milligrams, and metolazone. Doesn't seem to be working. Please help. Have you heard of nettle tea?
Yes, nettle tea. Okay. Looking for solutions to this. If your estimated glomerular filtration rate is 9, that's really low. So that's your kidney function is your kidneys are not functioning well. Put it that way, in that kind of a case. So sometimes the diuretics can help, sometimes they don't. But you think of what the diuretics do. They make you dehydrated. They cause your kidneys to excrete extra water. The other way to handle this is to not drink so much water. So you've got to be kind of careful because you don't have much kidney function at all. So it would be very important to work with your doctor in finding uh, the a smaller amount of fluid that you can drink during the day, which would be sufficient, but not too much to cause you to swell up. And so you'd have to be fluid restricted somehow. And that would be part of my solution. The other one would be to do the diabetes solution kit, and do the very low carb, get your insulin levels down so that you can maintain whatever little bit of kidney function you have.
Okay. Let's see. Charles says, what symptoms will be aided by taking Nervala?
The purpose for Nervala is neuropathy. And neuropathy comes for a lot of different reasons. And diabetic neuropathy is especially sensitive to this Nervala because Nervala has two different things in it. One that lowers the inflammation and allows the nerves to function better. And the other one is increases the circulation and allows the nerves to function better. People that have other reasons for neuropathies, such as toxicity, like if you had lead toxicity or mercury, Nervala is not the answer to that problem. So it's not the answer to every neuropathy problem. It is specifically made for diabetic neuropathy, but there are other metabolic neuropathies that it will help also.
All right. Winifred says, my A1C is now 6.4, but my glucose is still near 140. How can I reduce my glucose? I am age almost 87. I'm on low dosage metformin and take your chromium for several years. Thank you.
Okay. So obviously the synchrom and the metformin aren't going to do it. So the next step is to do the phase 1 of the diabetes solution kit. That is a wonderful way of lowering your hemoglobin A1C, lowering your average glucose, your glucose levels, because you're not going to be taking in glucose. You're going to be using fat for energy, and that lowers your insulin, so you have less insulin resistance, and you start using up all of the excess sugar that you've been storing over the years. So it's taken 87 years to get there, and it'll take only weeks or months to reverse that on phase 1 of the program.
All right. Sib says, with the cold weather outside, it's difficult to walk long distance outside. I'm considering getting a vibration plate machine. Can the constant, vigorous vibration damage my organs, such as kidney, heart, or liver?
Probably not. Your organs are very well protected from that. They don't need any. They don't need you to worry about them for that. Yeah, the vibration plates, they're fine, and they actually can help for some things like the nerves. People often have imbalance because their nerves don't function very quickly to restore balance easily. So, but a vibration plate can get the nerves functioning again, so that can be really helpful. But finding indoor activities that you can do is also probably pretty useful. Like running on a treadmill or doing chair. There's all these chair exercises I see advertised now that are really good, and squats and all that.
All right. Steven said my wife had emergency pacemaker installed 12/26 just last month. Her pulse was 28 and declining. She is home with normal blood pressure and pulse rate of 77. Is there any suggestion as to what I need to do for her? Nervala, etc.
I think looking at why did the pulse rate go down? What was happening there? Is it an energy problem? Is it a conduction problem? And some of those tests would have been done by the doctors. If it's a lack of energy in the heart, then the pacemaker just tells it how fast to go. But what else? Probably consider the 4 different nutrients to increase the energy system of the heart. So coenzyme Q10, L-carnitine, D-ribose, and magnesium.
All right. Deborah is asking when you should eat dinner.
Well, it's okay to avoid dinner. You don't even have to eat dinner because mostly your intestines have shut down by about 4 o'clock in the afternoon. And so you don't digest things well in the evening. You really digest and absorb and detox and cleanse your food that you're eating in the morning. And so it's perfectly okay to skip dinner.
Okay, Anonymous said, I read that phytic acid prevents magnesium absorption in the body. Unfortunately, it's found in spinach, sweet potatoes, beans, breads, and a list of processed foods. How does phytic acid get into natural foods such as spinach, sweet potatoes, beans, etc.?
Well, they're phytates. They're natural. The plant makes them. Spinach makes phytic acid, and yes, it does bind to minerals. But a lot of the magnesium, for example, in the spinach, is bound to um, a large molecule of it's I keep thinking hemoglobin, but that's the same as the hemoglobin molecule is the anyway, it's bound to a large protein molecule that kind of protects it from the phytates, from the phytic acid. And then calcium, same kind of thing. Yes, it's bound by phytic acid. And you can get deficiencies in minerals if you have too much of, let's see, like spinach and kale. I had a nutritionist in our office got toxic on kale. She started getting cramps from not getting enough nutrients because she was eating kale with every meal. So it's not that you should eat like the spinach every day, but you can eat it just fine, and it won't give you any long-term damage.
Michelle says, I have never fasted more than 27 to 28 consecutive hours. If I tried the 3-day fast, what is the appropriate way to break the fast?
I've looked at this because this was a big question mark about 100 years ago when Upton Sinclair wrote a book about fasting called The Fasting Cure. And he said, well, we've tried everything as far as breaking the fast. It turns out that milk is not a good way to break the fast. They tried that. And meat is okay, but it's not a great way. Actually, the best way to break a fast is with fiber. So that would be fruit, vegetables, beans, nuts, seeds, all of that kind of thing. Anything high in fiber is a really good way to break a fast.
Barbara says everyone talks about taking metformin, but no other types are mentioned. I had a study and it was for ribelsis.
Yeah,
Ribelsis.
Ribelsis.
Loved it. And now that it's over, the doctor decided to put me on metformin. Are there differences? What's the big deal about metformin?
The big deal is that it doesn't increase insulin resistance the way others do. It has other problems, and it's not completely benign, but it's not going to make you worse. So, for example, if you were to take Rybelsus, if you were to take a injections of the GLP-1 agonists, for example, they cause more insulin resistance. And so there are few medications that don't do that. So, and metformin is one of them.
Okay. Teresa says, I'm a bit confused about the either protein or carb diet you just talked about. I didn't quite get the difference between them.
Okay. So one is that you avoid all fat, and the other one is you avoid all carbohydrates. So one is a low fat diet, one is a low carbohydrate diet. And the low fat diet is like you don't have any fat at all. You can't even have an avocado. It's a no fat diet. You can't have any nuts or seeds or anything that's going to contain any fat. And then on the low carbohydrate diet, which is the diabetes solution kit, you eat less than 20 grams of carbohydrates a day, net carbs. So you can have fiber type carbs, but you wouldn't have anything that would be starch or sugar.
Right. Okay, Judy says, I'm on day 2 of a 3-day fast. I'm diabetic. I did not take my metformin or insulin while fasting. Evening blood sugar was 123, morning 153. Should I take my diabetes meds while fasting?
I don't think so. I wouldn't do it. The numbers wouldn't bear that out. The morning blood sugar goes up for a different reason. That's because your cortisol goes up. And while you're fasting, you're training your body to use less insulin, to start burning fat for energy, to start using up all the glucose that's stored in your body. So it's still an important way to go. And no, you don't need medications to help, and that won't help. Medications won't help your progress.
Okay. Let me see here. Barbara, I don't know what her beginning message was. It says, to continue, my glucose is fairly stable from 132, sometimes 115. Along with metformin, I use cinachroma and berberine. Okay, I don't know what her original question is here. Let me see if I can find this. Oh, just wondering what the difference between metformin was. She liked the study drug that she had done.
Yeah.
And so that was just some more information I think that she was sharing. Okay. Let me see here. What does chromium picolinate do for you? Tom would like to know.
Chromium is an important mineral that's necessary for the enzymes that help you to process glucose. And so you can use glucose more efficiently if you have enough chromium. If you're deficient in chromium, you can get type 2 diabetes just from having a chromium deficiency. So in cinachroma, we put chromium in there precisely for that purpose. It's not a common deficiency, but in people that have type 2, it is fairly common to be deficient in chromium. So the idea of chromium picolinate was that they used to have clinics, chromium picolinate clinics, that you could use sugar more efficiently, and then you could start burning fat, and they were weight loss clinics and things that would help prevent diabetes. But it only goes so far. If you're overeating, then you're going to still overeat. So the chromium's not going to help that.
Right. Okay. Anonymous said my calcium score was 879, and cardiologist is not really concerned with that number. He recommended Lipitor and ASA. I don't want to take pharmaceuticals. What do you know, if effective, about nattokinase?
Okay, so your coronary calcium score is telling you about clots. That's what it's telling you. So you have clots in your arteries, and what that's doing is forming this scar tissue that is getting calcium deposits. And so those calcium deposits is what's being measured in this coronary calcium score. 800 is a high number. It means you have a lot of clots that have formed over the years. And there is absolutely nothing about metformin. No, I'm sorry. There's nothing about a statin that could help that or make any difference in that at all. So that's not even a useful thing to think about. The other medication, what was the other one? Said a statin and
ASA.
ASA, yeah, aspirin. So aspirin is reasonable. Aspirin actually will prevent clots to some extent, but it may not deal with the problem specifically. So something like nattokinase would be a good idea, maybe. So look at why. Why are these clots forming, first of all? Do you have a lot of inflammation? Then you have to deal with the inflammation. Or are you not dissolving the clots? What if you have high lipoprotein A? Lipoprotein A stops you from dissolving clots. So you make the clots in your arteries, but they don't dissolve, so they organize and make this coronary calcium. So that's where lipoprotein A can be a problem. So look at your levels of inflammatory markers, lipoprotein A, and find out why you're creating these clots in the first place, and then deal with why, rather than just throwing something at it like nattokinase or something. Look for the why. So let's say you do have lipoprotein A is really high. In that case, nattokinase would be a good idea, because the nattokinase is going to help you dissolve the clots that the lipoprotein A prevents you from dissolving.
Okay. So Gerald says, so the 3-day fast is an absolute fast.
Yeah, be careful with that. If you're getting dehydrated and you're getting dizzy and you need a drink of water, for heaven's sakes, drink some water. But yeah, generally you just it's part of the thing is one of the mistakes people make is as they're fasting, for example, and they just want to put something in their mouth and they just keep sipping water, drinking things, or coffee, or people always ask, "What can I get away with?" Yeah. It's okay if you're thirsty. For heaven's sakes, drink some water. That's only going to be in your stomach for 5 minutes, and then you're fasting again, right? But going all day long and sipping water and all, that's not helpful. It's actually counterproductive, because you really do need an empty stomach. So yes, the 3-day fast is an absolute fast, but use good judgment, and if you're getting dehydrated, drink some water.
Okay. KJ says, so perhaps breaking a fast with a salad with protein, which is mostly what I'm eating on this program.
Yeah, that'd be great. That'd be a great way to do it. You're going to get plenty of fiber that way, and you're also going to get some protein. That's good.
Cynthia said,
shout out to Dr. Saunders on our team retreat last week in Florida. We're all together, and we had a lot of food opportunities, and Dr. Saunders was on his fast protocol, and he didn't eat for most of the time. I think
3 days.
And I think towards the end you had a meal.
Yeah.
Yeah, some salmon with the hibachi chef. So
nice.
But yeah, that's inspiring.
All right. Let me see here. Okay, Cynthia said, I had to start taking Lantus solo insulin as my pancreas was not making enough and my A1C was going up. Should I still take cinnamon, chromium, berberine, and Nervala? I have an antibody attacking my pancreas.
Okay, so you have autoimmune pancreatitis, and that autoimmune problem is creating or preventing your beta cells from making insulin, and so that's really important. So first of all, you already know what the problem is, so then now you can start with an autoimmune protocol to reverse that process so that you don't make antibodies against your pancreas anymore. So that would be the first thing to start with. All of those other things, the Synachroma nervala, are you can continue those as supplements. You know, I don't have diabetes, but I take Synachroma as a supplement. It's got vitamin D and chromium and selenium. It's just they're things that I recommend for everybody anyway, except for the cinnamon, which is fine. So you can continue the supplements, but that's not the way to deal with the problem. If you want to deal with the problem, then do an autoimmune protocol to reverse that process so that your pancreas can start functioning again and making insulin.
Okay. Time is up. Dr. Saunders, thank you so much. We appreciate you. We'll see you tomorrow.
All right.
And all of you, thank you for being here as well. I know we weren't able to get to all of these questions. Let me just double check if there's anything else that I can help with.
I gotta go as well. So
Okay, sounds good.
All right. See ya.
Bye. Okay, so come back next week, ask your questions. In the meantime, go to bartonwebinar.com and you can use code webinar25. You'll save 25%. You'll find all of our videos there, or a link to our YouTube channel at least, where you can watch past episodes and lots of really good information there. So check that out. Let me see. Okay, I think that's it. Oh, Eric is back. Hello. Okay, okay. We'll see you guys tomorrow. We have another webinar tomorrow, Home Cares That Work. And this is kind of the webinar on Thursdays where we talk about things that are within the health world, natural health a lot of times, that are maybe just outside of type 2 diabetes and heart health. So it's a really good webinar. If you haven't registered for that, you can do that at bartonwebinar.com. Free, same type of format, lots of good information. So I hope you're able to join.